Good morning or good afternoon, depending on where you're joining us from. We're just going to give folks a few minutes to enter the webinar from the waiting room. Thank you for your patience with us. And if you'd like, while we're waiting, if you could just put in the chat where you're joining us from, we'd love to hear where you're joining us from. Okay. All right, we're going to go ahead and get started. My name is Nicole Lamerson, and I'm a research associate at the Lurie Institute for Disability Policy, and I work on our National Research Center for Parents with Disabilities. And today we're presenting a webinar about living with anxiety as a disabled parent. And we really feel strongly that this is an important topic and a topic that we need to explore more. And we're really happy that you could join us today. Apologies, I'm having a little bit of lag with my screen sharing. Very quickly, just as a housekeeping moment, we are providing ASL and closed captioning for this webinar. However, please disregard this graphic as we are using the spotlight feature to provide ASL. And of course, captioning the icon for captioning is at the bottom of your Zoom screen. If you need any help with spotlighting and seeing the interpreters, please let us know in chat. There's also a Q&A box for questions. Very quickly, just a disclaimer about our funding. The National Research Center for Parents with Disabilities is funded by the National Institute on Disability, Independent Living, and Rehabilitation Research. And while we are funded by them, the contents of this webinar and the discussion we're going to have reflect our own opinions as both employees of the center and as people with disabilities, and not necessarily the opinions of our funders. I'm going to take a moment and very quickly just introduce myself. In addition to being a research associate at Brandeis, I am also a parent with a disability. I come at this wearing many different hats. I have cerebral palsy and I use a wheelchair, and I have an 8-year-old daughter. So when I talk about this topic, even as I'm moderating, it's personal for me too. But our panelists today are Judy Brown and Jenny Senda. And Judy Brown
Nicole,
is
can
the
I
founder.
interrupt you for a second? Would you mind just stopping sharing screen because I think people are having problems seeing the interpreter.
I
If you can
absolutely can.
stop sharing screen and then we'll just have the interpreter and you on the screen.
Okay. Give me just a second. Just to, okay. Okay, you're not seeing my PowerPoint slides anymore? Are we good?
Correct. Yes, you
Okay,
can proceed.
great.
Thank you so much.
Thank you. Sorry about that, everyone. Judy Brown is the founder and executive director of Project 74 Forward and is a passionate disability advocate and activist in the city of Charlotte, North Carolina. Her organization, Project 70 Forward, is a 501c3 nonprofit with the mission to support and advance the lives of people with disabilities through various programs such as pop-up neighborhood food distribution and community resource events, peer support for economic development in local communities, and individual advocacy. Judy works with other advocates and organizations to coordinate care and support throughout Charlotte for people living with disabilities. She represents the disability community on important issues such as housing and displacement, food security, accessibility, and economic mobility. Judy was born in New York City and relocated to Baltimore and then to Charlotte. She was originally a corporate administrator, and at that time, she left the workforce due to increasing disabling health conditions. Also, as a mom of two sons on the autism spectrum, her time became focused on getting them the best care and education for her children and for herself. After raising her two boys to adulthood, Judy took all her years of experience dealing with everything we deal with as disabled people: medical issues, insurance, education, and social service industries, and founded Project 70 Forward. Judy is married and she is a mom to an extended family of 5 children. Judy is also a member of our advisory board, as is Jenny Senda, who I'm going to introduce next. And I just want to take a moment and say that our advisory board members direct and help us determine the scope of our research, and they are involved in every sort of step of the way as we think about what we want to research as people researching disability and how we want to present that information. So having both of these fantastic women on our advisory board is invaluable to us, and they are both just a pleasure to work with. Jenny Senda is a Mexican American mother and a college student who has cerebral palsy and uses a wheelchair. Fluent in both Spanish and English, Jenny is a strong advocate for parents with disabilities and a blogger for the Disabled Parenting Project. Jenny lives in Kansas City, Kansas, with her 14-year-old son who has ADHD and anxiety and makes every day an adventure. Jenny believes the biggest issue facing parents with disabilities and their families is society's stigma, and she is pleased that the Center for Parents will dedicate attention to the needs and experiences of parents with disabilities in marginalized communities. And Jenny, we certainly could not do that work without you. So unfortunately, I can't share my slides, but real quickly, I just want to just give you a little bit of the lay of the land about disabled parents and who they are. About 1 in 10 children in the US have a parent with a disability. That's about 4.4 million people in the US. And people with disabilities are more likely to report health disparity and socioeconomic disparity, such as housing, food, and economic insecurity. Um, we know that people with disabilities are more or less having children at the same rate as their non-disabled peers, but especially for people with intellectual and developmental disabilities, they may be more likely to have adverse birth outcomes, and they may be more likely to interface with child welfare agencies. And when they interface with child welfare agencies, they're often more likely to have their parental rights terminated. And I think as we talk today about anxiety, um, this is an important piece of it. These parents often experience stigma based on their disability status or based on their parental status. You know, in the US, because of the ADA, thankfully, so many people with disabilities are now able to leave their homes. And many people with disabilities are in our workplaces and in our schools, although we still have so much work to do. But for some reason, it seems that parenting with a disability is still one of those last great stigmas that society has. And of course, this is based in this sort of history in the US of eugenics and sort of deciding who is fit or unfit to be a parent. And while many of our laws have changed over the years and people with disabilities have much more support in the community, sometimes these underpinning stigmas remain, and they can be huge factors in terms of decisions to parent or how to parent or how someone may feel about a disabled person parenting. And all of that can lead to anxiety. And just roughly, since the pandemic, we think about 20 to 25% of all parents report having some kind of anxiety. Anxiety seems to be very pervasive, just in the way that we parent now in this world that we're currently living in. So while anxiety itself can be a disability, today we're going to be talking about lived experiences with comorbid anxiety, that is anxiety that is sort of occurring alongside of another disability. And very quickly, just because I don't want to miss it, it was on my slide, just so everyone's on the same page, when we're talking about disability, we're talking about self-care disability, vision and hearing disability, mobility disabilities, independent living disabilities, and cognitive disabilities, in addition to psychiatric and mental health. So, with all of that housekeeping on the way, I want to open it up to our fantastic panelists who are going to share their stories. And I want to open this up with a question. So both of you have been moms for a long time, and I feel like you have a lot of wisdom to share with everyone who is joining us today. When you first became a parent, did anxiety affect you? And if so, how did it affect you? And Judy, if you want to go first.
Sure. Good afternoon, everyone. Thank you for joining with us. Very happy to be here and share wisdom in our journeys. So, when I first became a parent, we were in and we've talked about this, Nicole, a multi-generational home. So I had parents who were dealing with being seniors, and I was living at home with them, and I found out that I was going to have a baby. I was married at the time, and we were living with my parents. And so at first there was a lot of joy, this was going to be a grandchild, and, you know, life is always wonderful to celebrate. But internally, I did have a lot of questions, so really quickly, I'll do a visual description. I'm an African American woman who's wearing very heavy prescription glasses. I have a big, fluffy kind of lock hair. I'm wearing a purple shirt. The first thing I was afraid of was that these children are going to have the same disabilities I do. I'm visually impaired. I'm one-sided hearing impaired, deaf on one side. And at that time, I was beginning to deal with the mobility challenges that I had and energy challenges that I had. And I was so afraid that they were going to develop these things as well. What I didn't know on my husband's side was that there are generations of people dealing with mental health challenges and, developmental disabilities. And so we had a grandfather, a mother, and then, so that's a great grandfather, a grandmother, and my husband who were not diagnosed with the intellectual and developmental disabilities. But I was noticing something. So there was a lot of anxiety of what's going to happen to these kids? I mean, what are they going to come out with? And every parent wants a healthy and a happy child, every parent. But I knew there might be some things stacked against them. And that was the beginning of an anxiety of bringing a life into the world. And, the question, I'm going to put it out there, should I bring a child into the world, knowing that I have all these things going on? That was very, very concerning.
I think that's a very heavy question, especially in light
Yes.
of how we know society views people with disabilities and people with disabilities who are caretaking when they may, in fact, need caregivers themselves. Jenny, do you want to add to that? When you first became a parent, how do you feel that anxiety affected you, if at all? You're on mute, Jenny. You're still on mute.
Technical difficulties.
That's okay.
Sorry.
We've all been there.
So when I was 16, I was told by a doctor that I would not be able to have children.
Mhm.
There's a big difference between can't and shouldn't. So my son was a surprise. I come from I'm a first generation American citizen, like born here. I'm also, like I have Latino features and, my hair is cut short and I have an orange sweatshirt on and I'm wearing glasses. So it's very obvious, CP is a very obvious condition. So when I had Edward, everybody was like, how are you going to take care of him? You can't walk. So, and everybody kind of externalized my fears around me, which is very hard. It's very hard because you're working on your own fears. Okay. Um, sorry. Um, I also, had to struggle with, okay, am I going to be okay? Because there were health complications that came along. My mother is not one to go to the doctor, so, I didn't know what could happen along with the pregnancy. So it was kind of hard for me. It was a struggle.
Yeah. I think your point around externalizing people around you, externalizing your fear, is really, really salient. Um, there is that sort of anxiety that any new parent has, but when people are sort of looking at you and wondering, how are you going to take care of that baby or that child? It brings the anxiety to a whole new level,
Yeah.
and can be sometimes maybe harder than the actual disability itself. And I'm wondering if maybe we could talk about that a little bit, about how others' opinions and fears and feelings about your pregnancies and your parenthood decisions impacted your own mental health. Judy, you want to go?
Well, that actually wasn't much of my experience. Again, my parents, and I do have to tell this history. My parents were alive when I first found out I was pregnant, but and so they were there the first 3 years of my first son. But in my second pregnancy, I unfortunately lost both my parents about 6 weeks apart. And so here I was. And I also lost my marriage at that time. I tell people it was the worst 6 months of my life. Um, and so it was a lot more internal for me. Like, what in the world am I going to do? Grandma and grandpa are gone. Husband is not here. I'm a person that was at that point finally out of the workforce due to all of my conditions. And here I have a 3.5-year-old that we were discovering was going to be on the autism spectrum, and I'm pregnant with the second one. And so there wasn't a lot of external, what are you going to do? There was just abandonment. That's what I dealt with, which was abandonment. Everyone kind of moved away. You're not working. The family is like, oh, poor you. And I dealt with, that's when I really actually got the diagnosis of anxiety, was because there was abandonment issues everywhere. And here I am with a soon-to-be newborn and a 3.5-year-old and I'll date myself. This is 30 years ago when we weren't talking about autism the way we talk about it now. And so the anxiety was extraordinarily internal of what am I going to do?
Mhm.
But I literally was very much abandoned. It's like people didn't come and say, well, how are you going to parent these kids? They just didn't show up. It was just literally silence and trying to figure out, how do I navigate this? I don't even understand what's going on. I still have my own specialists and doctors, and now I'm by myself doing all of this. So a little bit different of a
Yeah, but
direction.
equally important and equally tough. I just want to acknowledge that no one should feel abandoned during a pregnancy or at any other time, but during a pregnancy is particularly rough. Jenny, Do you want to add anything around sort of the feelings of others around your pregnancy as a disabled person adding to your anxiety?
So yeah, so there's always a perception. So I would call it, in my opinion, a societal perception of whether or not a person with a disability can function in normal life. Um, because most of us, at least in media, are perceived as, oh, the inspiration, or, and I'm not inspiration porn. It's like, no, I am a fully capable woman. I may have to do things differently, but I'm a fully capable woman. It's a hard lesson to learn because
Mhm.
you're told, oh, you may not be able to do this, or you may not be able to do that, or you can't do this, or how are you going to do that, or that this place isn't accessible. I mean, even you know, 30 plus years after the ADA has passed, you know, we still live with the anxiety of, if I go somewhere, is it going to be accessible? Are the
Mhm.
ramps going to be too steep for my chair? Even a power chair, because some of these ramps are crazy steep.
Mhm. Mhm. I hear that.
It's crazy. And then, you get home and you get the barrage of everybody's opinion of, how are you going to take care of this baby? You can't even take care of yourself. You know.
Yeah. Yeah, I actually had a hematologist say that to me, and I was like, this opinion, while I was pregnant, and I'm like, this opinion has nothing to do with why I'm in this office. It's almost like our pregnancies as disabled people are never, ever universally celebrated. And we hear this in our research, and I hear this from folks I talk to on a weekly or monthly basis providing technical support, that there's this worry and this fear, and there's not always a pause to celebrate a pregnancy that may be very much wanted and loved. um I want to talk for a minute about what helped you in terms of your anxiety. Is there anything in particular that helped as you were progressing as a parent? And every week, every day, the child you're parenting changes, and the game gets changed up. Like the minute you're used to what your method, and so as you're going through that parenting journey, what helped your anxiety? And also, is there anything that made it worse?
Yeah, I'll go first again.
Mm-hmm.
What helped was I built a tribe. I call it the tribe of women who were either successful parents or who were, had that strong wisdom. And I really believe they helped me go through because there was a point where I seriously contemplated not keeping my sons. I contemplated that they might be better and not necessarily in the system, but with another family or a more complete family. I mean, literally, it was myself and two children. And so, and I had very strong women who said, oh, no, we're not even going down that road. We're not thinking about it. What do you need? And so there was a rally of friends, some members of faith-based organizations that were like, what do we need to help you and support you? Um, what really made it worse was just isolation. And then, yes, some of the medical fields that I had to go to, which was like, okay, you already have all these other things going on. Um, you know, what do you do? What's the thought here? Where's the plan?
Mm-hmm.
And, I really kind of had to push back against, we can't plan for everything. And sometimes we just have to muddle through and learn as fast as we can and catch up as much as we can. Um, but there was more stress from the medical, we need you to take care of you, but now you've got these two children. How are you going to do this? Um, and my saving grace, really, therapy.
Yeah.
I literally went into therapy while I was still pregnant
Mhm.
because the overwhelming stress and anxiety of grief because I've lost my parents, grief because my marriage has ended, grief because even my job ended at that point. They were like,
So
"Well, you
much.
can't make it here and you're already pregnant and you're probably going to want to stay." I mean, it was such just the idea that, okay, next, because you're dealing with all this stuff. And so therapy was the lifeline that kind of saved me
Mhm.
from those experiences.
Yeah, I wanna put a pin in that and come back around and talk about therapy and what we might want to look for when looking for therapy as a or a therapist as disabled people. Um, Jenny, do you want to add anything around what helped or what made your anxiety worse?
So what helped me, and I didn't get into therapy until Edward was about 9, so about 5 years ago. And there was a lot of childhood trauma in my life that kind of filtered into my parenting, which added to the anxiety of the parenting. Like,
Mhm.
am I doing this right? What if I screw what and excuse my language, but I'm like, what if I mess up my kid? What if I screw up my kid and he ends up with the same issues and then he ends up in therapy as an adult, you know? um what therapy and finding a great therapist has been an absolute godsend for me.
Mhm.
um it's been amazing. Also finding a village and learning to set boundaries
Yeah,
Mm,
when people say too much
yeah.
or give their own opinion when they don't have experience,
Mhm.
because this is a new experience for any parent,
Mhm.
let alone a person with a disability.
Absolutely. And we give most new moms and dads sort of the grace and space to figure out how they're going to parent. And when it's like a joke when like the dad's figuring out how to change a diaper and what do I do and how do I do it, everyone laughs. Whereas if you're a parent with a disability and you go, how do I change this diaper? No one gives you the grace and space to figure it out. And that can be very anxiety provoking in and of itself when, despite our disability statuses, we're still new parents and still trying to navigate how to how to do this job, which is, really one of the hardest jobs in the world. Can we talk a little bit about finding a good therapist? Um, there's no website that's like www.besttherapistfordisabled parents.com. And so I'm wondering, how did you go about finding someone who understood you and was really willing to work with you and learn about disability? How did you go about that? And what makes a therapist good and and effective for someone with a disability who's a parent?
mm. That's a lot. I don't think I went about anything. I mean, I literally was like, help.
Mm-hmm.
Someone helped me because at that point I was not sleeping. So that's one of my triggers. And I know not a trigger, but a sign that I'm in anxiety is I'm not sleeping. So insomnia, just those loop of thoughts. And so I do believe I went to my doctor. And this I love the medical field, but then sometimes I have a love-hate relationship. They ask you all these wonderful questions. How are you feeling? Do you feel sad? And then they file it and they really don't follow up on it. And
Really
so
don't.
I literally had to be very vocal. I need help. I'm not doing well. Um, but they really didn't pay attention till toward the end, I stopped showing up for my prenatal appointments. I was literally that was spiraling that bad. And so there was a referral from my primary doctor. And I literally said, listen, you're going to have to listen. And he listened. And that was one of the best things is find somebody who is not, and this happens, and I'm going to talk about it. Find somebody who's not going to have all of these preconditioned, and you think with therapy they shouldn't, but they do. Find someone who's really going to be open or who has had the history of working with people with disabilities or working with what you're dealing with before you even go in there for that cognitive and that behavioral therapy. Because this gentleman, the first one I ever went to, he let me talk for almost the whole 45 minutes. And then it was like, okay, we're going to create a plan. You look like you're a planner, you like to plan. And the biggest thing he did was validate why I felt the way I felt. Oh my goodness, I'm going to go there. Sometimes, oh, you're just so strong. We know you've got it, blah, 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 blah. No, the strong people don't always have it.
No.
And he literally acknowledged, I see you've literally lost parents, husband, job. You've given birth to children. You're finding a child. You're finding out your oldest son is on the spectrum. He didn't speak until about 4. So it's like, you've got a lot on your plate. And just that acknowledgement meant the world to me. I felt seen, for someone who had been abandoned, I finally felt seen. And I just, as soon as he said, we're going to create a plan, I was like, yes. So make sure you feel seen and completely heard and not in any kind of typical, oh, this is what I do way. Literally, really seen and heard. I mean, I could talk for hours about the medical field and my ins and outs with them, but I've learned to say, I got to feel seen. And I just want to say this, I continued that until it wasn't just general anxiety disorder. They became and understood that I have a selective anxiety disorder. There's times that anxiety in my life is going to overwhelm me, and it's mostly tied to my current health condition. If I'm stable, I'm pretty good. But then there comes these times when there's changes, and that's when the anxiety. And I got, people to really hone in on that. So it's just people who listen and who get it.
Yeah.
And my final word is don't be afraid to fire anybody in the fire them. Get rid of them if they're not meeting what you know you need. Okay,
Yeah.
I'm gonna be quiet.
Yeah. I hear so much there about perseverance. And I think as disabled people, we have to be so aware of our own medical conditions. And it, like, you were so there. And I think that's really important to acknowledge. Jenny, do you want to add anything about finding a therapist that you felt was competent around issues related to disability and parenting?
So in 2019, when I first went into therapy, I went into therapy and I was matched up with this fantastic therapist. And she could really relate to me. And I'll tell you why. She is a person who was not born with a disability, but a few years earlier, she had had an accident that had hurt her back, and she had to use a wheelchair. So that gave her a kind of a different perspective. So she could relate to me and the struggles, I was going through in a different way. Well, during the pandemic, this therapist had some health issues and some personal issues. So I was switched to another therapist. And I totally agree with Judy's assessment that if they don't work for you, you should fire them. Because I did not. And this therapist discharged me before I was ready. And so I'm like, okay, I'm discharged. It's kind of like, you're healed. So I was discharged too early. And my friend's like, you need to go back into therapy. I don't know what's wrong with you. So they matched me up with another therapist who was fantastic. And she told me, one of the biggest things that she told me is it's okay to fall apart. It's okay to let your body do what it needs to do, because my entire life I had been fighting it. I'd been fighting against spasms. I'd been fighting against, um, you know, life, love, and the pursuit of happiness. You know, because, I was taught when I was younger, you're supposed to be grateful to be alive, you know? So, the minimization of the pain is just absolutely crazy. So when I finally found a therapist, and then I was matched up to my previous therapist that I had before, and she's fantastic. I love her. But I told her, and she said, "Why didn't you fire her?" And I said, "I didn't know why." Like you get anxious about, okay, this person isn't matching, but I mean, what do I do now?
Yeah. Yeah. Firing a healthcare provider takes a lot of bravery. And especially, with our healthcare system where there's no guarantees that another provider is going to be around the corner or is going to take our insurance if we have insurance. So it definitely takes a lot of bravery. And one thing I heard in your story, Jenny, was COVID. And this really resonated with me because it was actually during COVID that I realized, oh yeah, I totally have anxiety. And I too was able to find someone who was really, really fantastic. I found the person that I worked with by going to a couple of different disabled parenting groups on the web and sort of working my network of other disabled parents, mostly female parents, and was able to find someone through a friend who was like, this person is not disabled, but I believe this friend said to me, I've already broken her in for you. Sort of like I've already, she's already kind of got the lay of the land as disability as a social from the social model. So you're not going to have to start at ground one at the very beginning. So I really appreciated that. I think there's a lot of emotional labor that a lot of disabled people do for each other. And that was certainly a moment of that for me. Um, I want to take a moment because there's so much wisdom on this panel. And I know from looking at the chat that we have some folks in the chat who are pregnant or who have had children very recently who are also parents with disabilities. And congratulations. It's the best thing ever. Um, I want you to know that I'm happy for you. And even though, we're talking about this hard topic, it's still incredibly joyful. Um, so what do you think new disabled parents should know about anxiety and navigating anxiety? Jenny, want to go? You're on mute.
Yeah. So the anxiety, one thing that should be first and foremost in your mind is the anxiety is going to come because it comes for every parent. And it's okay to ask for help. You don't have to be superhuman just because you have a disability, because you have nothing to prove. You're here. You're living. You decided to take this step, and that's brave in and of itself for any person, not just a person with a disability. It is a wonderful choice for those of us who choose to make that choice, but the anxiety will come. You are not less than because you have it. It doesn't have to overtake your life, but I mean, you can also use it as a tool. Like, okay, let me take a step back. Let me refocus. Let me regroup. Let me ground myself a little bit and let me look at it from a different perspective. because, you know, we already know how to adapt and roll.
Mhm. Mhm. Judy, do you want to add anything to that?
Well, yeah, Jenny hit the first thing is that yes, anxiety, it's almost as if that is a normal response to maybe some overwhelming things. You just want to be aware of when it begins to interrupt your life activities. And that's why I mean, I can feel anxiety because I'm on this webinar and I sometimes talking in front of people makes me anxious. But when it became something that interrupted my sleep and the way I was eating and I wasn't myself, then please feel so comfortable to talk about it, tell someone and get that help. Um, and as a parent, listen, I had absolutely no idea. I thought I was going to have a whole family around me to raise my sons. And then I didn't, like I said, 30 years ago, talking about autism or even being diagnosed properly was not something that is done as easy as we do today.
Mhm.
Um, you are going to figure it out. I mean, literally, you are going to figure it out. It is okay to maybe stumble a bit and make a mistake and have to backtrack and move forward again. That's part of life in general. And as a person with a disability, like Jenny says, we are already overcomers and multitaskers and figure it out and stick to itiveness. You have every right to bring a life into this world, to love that life, and to raise that child. You have every right. And don't let anyone make you feel that somehow you are less than.
Mhm.
Please don't let anybody make you feel that you're less than. Surround yourself with the people who are going to be there for you. Um, and Jenny talked about her son is 14, right? Jenny? Well, mine, I'm dating myself. Mine are 28 and 32. So they are completely grown men, um, still, individuals with autism, but they're great people. And I didn't know this, 32 years ago.
Mhm.
So you can do it. Don't give up. Don't let anyone persuade you or make you feel less than. You can do this.
Absolutely. I mean, we are people with disabilities were great problem solvers. And I remember telling a nurse when my daughter was a NICU baby, and I was like, this is kind of a catastrophe I've been training my whole life for. Do you know what I mean? Because we problem solve so much that I think sometimes we forget it's an actual valuable life skill and not just this thing we do like brushing our teeth. You know what I mean? Um, I really want to thank you both for your candor. This is just a really wonderful discussion. I want to really quick look at our Q&As. We have two Q&As. The first one from Elizabeth Mello, I'm going to address in a second, but we also have one asking, have you ever spoken to your children about anxiety?
So I'll go first if you don't mind, Judy.
Oh, you go ahead.
Um, my son actually has anxiety,
Mhm.
so we speak about the topic a lot. Um, my he has generalized anxiety disorder, and it's comorbid with the ADHD. So sometimes our anxiety kind of flows together and crashes into, each other. So I'm like, okay, time to take a step back. Let's take a step back because you need a moment. I need a moment. We are very open in our house about anxiety, or I'm feeling a little overwhelmed, or such things like that.
Mhm. Mhm.
And I'll add real quick. So I grew up in a home where we didn't talk about our emotions and we didn't tell people how they were. And so I made the conscious effort with my boys that we would talk about how we feel. We would talk about emotions. Nothing was off, that you couldn't talk to your mother about. And so in that, my youngest son, not only being on the spectrum and having ADHD, He also has I forgot what they call it now. Um, he's got dysautonomia, so he has a non-regulated autonomic nervous system, and it took us 3 years to get that diagnosed. And so he began to develop anxiety because he didn't know what he had. And so therapy has become part of his life. It is part of a continuing part of his life, anxiety with depression. My oldest son has been in therapy for various parts of his life where he felt stressed. I think this is so part of just what we need to do for our whole health care. So, yes, mental health is very important in my home, very important.
Thank you for that. Our We have another question in the chat. Where do I find a network of parents with disability in Massachusetts? So I'm in Massachusetts, in Waltham at Brandeis, and also looking for a parent support network for a parent with MI. Um, do either of you want to comment on finding support, finding your village as disabled people, and then I'll address this sort of a little more specifically. How do we find the people that get us when we have a disability?
So, I found my village through Facebook and through other people with disabilities. And I had a wonderful experience in my childhood years because I went to a school that was specifically designed for children with disabilities. It was started during the polio epidemic in the 20s. So we kind of were our own little utopia. So I've kept in touch with them over the years. Like I said, Facebook is a wonder. Um, you know, there are resources like your local library. I know a lot of people don't like to go to public assistance, but the your local public assistance office can often provide you with some sort of resources, not exactly specified resources, but maybe they can guide you to support groups or even your pediatrician, you know, um, because we have to open up those avenues for like the medical professionals and to see us as human and not just patients to treat. I Yeah, go ahead. Michael.
Facebook was my first spot, but even before Facebook, like I said, I'm a little bit older, so there were separate organizations that would have their own message boards, and that's where I connected with a lot of people because sometimes, and especially like for my son, and for his support, there wasn't anyone around us who was presenting with dysautonomia, and so we had to go online and look for, organizations or people. I also know some of the hospitals know about support groups, and also we have in our Parks and Recs, we have the adaptive sports. So that's also another area that you can find supportive groups. But Facebook is an absolute godsend. I literally probably belong to over 100 different groups, depending on what is presenting and what I really need support with.
Mhm.
So that's one of but I will give you this caveat. Stay away from the ones that are just complaining about what's wrong, what's wrong, what's wrong. Look for people who are really about what solutions, and are supportive because you can get in that kind of negative, conversation about what's wrong. And that's really not going to make you feel better. But I have some friends that literally I've never met. We are still friends over a decade because we met online discussing our conditions and giving that, information back and forth.
I'm really glad that you brought that up. I think the internet is a great equalizer for all of us with disabilities in terms of finding social networks of support. And I've often said to many, many people that your internet friends are real friends, and that those interactions are no less than the sort of interactions we all say we want to have in real life. But as busy moms, we never quite get around to having that coffee date with our one friend in town. Do you know what I mean? Or our small group from high school or college. And sometimes at 11 o'clock at night, when you're trying to wind down, it's your friends on the internet that are available. I am not sure I would have even contemplated pregnancy seriously without seeing other women, specifically in a group for moms with cerebral palsy, becoming parents and raising their kids. And this was a group on Facebook. It's called Mommies with CP. There's also another Facebook group. One of the moderators in this group is on staff with us. The group is called the Disabled Parenting Project. I have a slide with all these things on it, but I can't show my slide. So I've put my email in the chat. There are other groups. There's some specific groups around spinal cord injury. There's a group called the Wheelchair Mommies group. That one is on Facebook as well. And Judy, you brought up such a great point about adaptive sports. I forgot how I came to this whole world of disability advocacy, and that was through disabled sports. I used to get together with a group of folks in the state where I grew up, and I would go hand cycling every week. And that was and they had a hand cycle I could use because I certainly couldn't afford it. But that was my first experience, like getting out and about in public with people that looked like me and moved like me. And that was so important in my self sort of actualization. So I think even if you don't think you're a sporty person, you never know, where you're going to find your tribe and your village that will support you as a parent, even if the way that you find them isn't specifically parent related. Like, the moms in my town have figured out that pickleball is a great way to meet people. And I'm not playing pickleball in this lifetime, but like, they're onto something, finding people who can support you as parents, even sort of outside of this parenting realm. I want to take a really quick look at the chat just to see if there's anything that I've missed. We have a comment in the chat where we try to teach our students firstly to congratulate when talking to a pregnant woman. I believe this comment is from Vera, and I'm assuming you're probably a provider, educating provider, and I just want to say thank you for that. If that is regardless if that's a pregnancy that seems to be wanted, and I think it's really important, especially for parents who have disabilities. We also have a comment here from Cheryl. There's also the assumption of some kind of asexuality for disabled people. So on top of judgment for choosing to parent, they're surprised when you are sexually interested, let alone active. And I just wanted
Can I say something?
Yes,
Oh my gosh.
Yeah.
Thank you.
Snaps.
Because, it was like, okay, your first marriage, didn't survive and you have these children. So you should probably be without anything for the rest of your natural born life. And no, I have remarried, and I'm even proud to say that I usually don't even say this, but I love that comment. He's younger than I am, and he gets it, okay?
Mm-hmm.
And my whole thing is, please do not give up on life. Please do not give up on pleasure. Please do not give up on love, because you're a parent with a disability, whether, in a committed relationship or in a partnership of co-parenting, however you find yourself, please do not give up, and please fight that stigma. Yes, we have personal lives.
Yes. I think that is such a great thought to sort of close this out, I we in our work, we do a lot of work around sort of reproductive justice, and we talk about reproductive justice, reproductive access, all of these things. And one of our Carrie Buck Fellow last year, which you can find more information about this on our website, Robin Wilson Beatty, she made a wonderful comment about, what about reproductive joy? Like, we deserve that too. And I think in sort of the totality of all of this, that it's really important to remember that even when we're anxious, that bringing kids into the world and being a parent can still be just incredibly, incredibly joyful. There's a link to a satisfaction survey in our webinar. If you could, in our chat, if you could fill that out for us, we would really, really appreciate it. We pull webinar ideas and bring them to our advisory board from these surveys. So we really do read them, and we really do take your feedback into account, because we want to keep bringing relative content to people with disabilities and providers and family members and friends. And with that, we're going to close this out. Thank you so much for joining us today, and have a great day. Bye-bye.